Time for the Slocum-Dickson Medical Moment, courtesy of Slocum-Dickson Medical Group on Burstone Road, 798-1500, SDMG.com, Slocum-Dickson Medical Group, SDMG. That's how I remember it. Yeah. And also make sure you like their Facebook page, follow them on Twitter, and just that way you can keep tracks on what's going on, because things are always changing, things are always growing, things are always expanding and
getting better.
Seriously. And of course, Adrian in studio. Adrian, good morning.
Good morning.
Welcome back from the weekend, and happy belated birthday.
Oh,
yeah,
thank
I did.
you said it.
Yeah,
thank you.
Yeah, you're welcome. So what is new at Slocum?
Oh, lots of stuff. We have a lot of new doctors that have been coming in. We had two that joined a little bit earlier in the summer. Dr. Vasali, who's a hospitalist, and Dr. Powers, who's a podiatrist. And then we have Dr. Dean, who's a new oncologist, who joined just September 1st last week. And then Dr. Bison, who's here with us today, who's a cardiologist, who just joined us last week also. So we're bringing them right in as soon as they get started.
So, Dr. Bison, good morning. How are you?
Good morning. How are you? Good.
I'm great. So this is literally your second week, and you're
radio,
and you're right in here.
Yeah.
So did you realize that this was part of the job description at times? No.
Not initially, but
okay.
After talking to Adrian,
I just bombarded them all at once.
It's fine.
You're just going to come with me.
It's fine. Don't even worry about it. The cool thing about doing at least our show, I don't know about anybody else's, because I haven't been on anybody else's.
We're the best.
So,
we're the best.
The opposite of what Liz said. But the fact is like we literally are just like hanging out at the coffee shop, hanging out at the bar, and and one of the things that I saw is you're a cardiologist, but you're an interventional cardiologist.
Correct.
So what exactly does that mean? Like, do you go in? I'm thinking of when you think of an intervention, you walk into a room and all of your family and loved ones are there, and they want to talk to you, and all of a sudden it's like what So I'm wondering what as far as an interventional cardiologist, what does that mean?
So it's an intervention for someone's having a heart attack. You'll come into the hospital and we go to what's called the cath lab. And typically with a heart attack, when the blood vessel to your heart is blocked, and we pass a wire through the blockage, and we can deploy a stent, which is almost like a scaffolding, which opens up the artery and allows blood flow to go pass through to the heart.
Okay, so you're a lifesaver.
Yeah, it does procedures.
Yeah, it's fine.
I cut through it, and it is what it is. One of the things that I've heard, and luckily I haven't had a heart attack. What are the warning signs? Because I think there's some different information out there that could be wrong. Some are wives' tales and some are real. What are warning signs? What are good warning signs?
So the classic cardiac symptoms that we tell patients is chest pain on the left side of your chest. You get radiation down to your left arm as well as up to your neck. So that's a typical pain, but people are different and people present differently.
Right.
And most common, we'd say, is for women. Their symptoms can be a little what we call atypical. They could feel like indigestion, abdominal pain, or just nausea, vomiting,
really?
And that could be signs of a heart attack as well.
So it could be either a heart attack or they're pregnant. That's
It kind of sounds like it.
Yeah, but you definitely want to get it checked out. And literally, when it comes to something like this is serious stuff, because you never until they're in there and they're seen and diagnosed and whatnot. People really don't know how severe something is like this, right?
Exactly. So the thing with a heart attack, you don't know unless you're having it. But there's so many things you can do to prevent a heart attack from happening. That's kind of what we're trying to portray to people. It's kind of getting in early to see your physician at a younger age, getting the necessary testing done, and basically having a healthy lifestyle and things that you can do to modify risk factors for developing heart disease before you get it.
Like what kind of stuff to modify that?
Honestly, the most important thing is that we see amongst patients is quitting smoking. If anybody smokes, that's the most important thing you can do is stop smoking.
Now, does that include like vaping? Like vaping's a big thing now. So does that? I mean, obviously cigarettes and pipes and stuff like that and cigars. But what about does vaping kind of go into that as well?
So the issue with vaping is that it's just new and recently came out. There really aren't many long-term studies or data to say whether it's safe or not, and I can't tell you tell you myself, just because the information isn't there.
But honestly, if you're putting a foreign substance into your body, more than likely it's gonna be.
Yeah, and why risk it? Why risk it when you don't know what can happen?
Absolutely. Dr. Bison in studio, and Adrian, the Slocum-Dickson Medical Moment. Slocum-Dickson Medical Group, Burstone Road, New Hartford, 798-1500, SDMG.com. Like them on Facebook. And listen, if you're looking for a new primary, they have spots. They have amazing, like Dr. Silveraja is my go-to.
Yeah.
He's my guy.
Yeah.
He's my dude. He's my bro. So
He's your bro.
So listen,
Okay.
the fact that you can go in and you have to have a test done. Say they heard something a little funky in your heart. They can be like, okay, you should go down the hall and see Dr. Bison.
Right.
And you're not wasting time. You're not taking more time off of work. You literally are able to walk down the hall and being able to not have to worry about whether your files transferred or this, that, and the other. It's all under one roof, and it makes things so much easier.
Right, it does. And you know what? I forgot to mention, we do have a new primary care physician starting. So in October, I know you reminded me. Thank you. In October, Dr. Odua is another new physician that we have, and he's actually family practice. So we have quite a few. They're on our website, sdmg.com. And Dr. Bison was talking about preventive care, and that's the biggest thing, is just to have a doctor so that you're being checked all the time and you can spot these things before they become a big problem for you. So.
Absolutely. Like the Facebook page, sdmg.com. Slocum-Dickson Medical Group. It is the medical moment here on KISS FM.